Hello everyone. In this lecture, we will discuss about the structure-activity relationships of penicillins. All of you know that penicillins are a class of antibiotics which are particularly useful in the treatment of a variety of infectious diseases. And we will look into the brief history of the penicillins. So, penicillins was first discovered by a famous scientist known as Alexander Fleming, which was happened serendipitously, not by chance, and this penicillin molecule which was isolated by Alexander Fleming has shown promising action against bacterial infections. Previously, there were no proper antibiotics in order to treat a variety of infections, and we can call that era as a pre-antibiotic era. In the pre-antibiotic era, even with a minor infectious disease, most of the patients were died. And with the advent of developing synthetic antibacterials, followed by the first antibiotic, that is nothing but the penicillins, that was discovered by Alexander Fleming, has changed the scenario completely. And Alexander Fleming, a famous physician and microbiologist, in 1928 he has isolated the penicillin from Penicillium species, and further a lot of work has been carried out by a variety of scientists like Ansbury's Chain as well as Howard Walter Florey, and both these scientists in association with Alexander Fleming has successfully elucidated the structure of penicillins, and they have also represented the activity of penicillins, for which they were awarded with Nobel Prize in 1945 in physiology or medicine. And chemically speaking, they are a class of beta-lactam antibiotics. So, what are beta-lactams? Beta-lactams are a class of drugs which contain a lactam ring. Lactam is nothing but cyclic amide. For instance, if you see a beta-lactam is like this. This is the structure of beta-lactam. So, this is a carbonyl group, and this is alpha carbonatum, and this is beta carbonatum. On the amino group is present on the beta carbonatum, and collectively this ring is called as the beta-lactam ring. And all these beta-lactam antibiotics are typically isolated, the penicillins in particular, from Penicillium species, whereas there are also another type of beta-lactam antibiotics, that is nothing but cephalosporins. They were isolated from Cephalosporium species. And without much focusing on the basics, we will move on to our most important thing, that is nothing but the SAR of penicillins. Before looking into the SAR of penicillins, we should basically understand the structure of penicillins. So, the penicillins are typically, they are the derivatives of 6-amino penicillinic acid. If you see the penicillin scaffold, it has a beta-lactam ring as well as a thiazolidine ring, and there is an amino group at the 6th position of this particular bicyclic ring, and this overall this scaffold is called as the 6-amino penicillinic acid. We have a variety of penicillins which are natural penicillins, and we also have semi-synthetic penicillins, and all these penicillins have a basic core moiety in them, that is nothing but the 6-amino penicillinic acid. And coming to the more detailed version of the structure of the penicillins, and the penicillins contain a core penam ring. Penam ring is nothing but, if you see, this is a beta-lactam ring, yes, and the beta-lactam ring is fused with a 5-membered thiazolidine ring. This particular scaffold is called as penam. It is called as a penam, and this penam is formed due to the combination of the beta-lactam as well as the thiazolidine ring. And in addition to this, the penicillin has a side chain, that is acyl amino side chain. This is another important side chain which is critical for altering the spectrum of the activity as well as the acid stability as well as the overall bioactivity. If you see the structure activity relationship, all these are essential for the activity, and particularly the nature of the R has a marked influence on the physicochemical as well as the biological properties of the penicillin molecule, right. And before going into the details of the structure activity relationship, I told that the beta lactam and thiazolidine ring are quite essential for the activity, and if we understand the molecular level mechanism of action, then we can easily understand why these structural features are essential for the biological activity. So, coming to the mechanism of action, and there are two types of bacteria typically, the gram positive bacteria and gram negative bacteria, and the gram positive bacteria are enriched with peptidoglycan layers. The peptidoglycan layers present in the gram positive bacteria will maintain the cellular integrity and protects the bacterial cell from lysis. And one of the important enzyme that is required for forming this peptidoglycan layer is nothing but transpeptidase. And the penicillins are very much attracted toward the transpeptidase, and they cause the inhibition of the transpeptidase. If the transpeptidase enzyme is inhibited, it cannot synthesize the so called peptidoglycan layers. If the peptidoglycan layers are absent, it leads to the lysis of the cell, right. So, I told that it will act by inhibiting the cell wall synthesis. The cell wall component is particularly, that is nothing but the peptidoglycan layer. It binds to the transpeptidase enzyme and prevents the peptidoglycan cross linking, which leads to cell lysis. So, if you go in a molecular way, the transpeptidase enzyme. So, this is the component is nothing but the transpeptidase enzyme. If you see here, there is a serine residue, as serine is an amino acid which contain a hydroxy group, and the beta lactam ring, the 4-membered ring. You also studied about Bayer strain theory. The ring size, whenever the ring size is low and it is having more angle strain. So, the beta lactam ring which contain a 4-membered ring, it has a lot of angle strain. That is why, because of this strain, the ring will readily open whenever it comes into the vicinity of electron rich sites like a hydroxy group, it will readily open. So, because of that, as and this is the active site of the transpeptidase enzyme, the beta lactam ring or the penicillins will come and sit here, and they will form a new bond with this particular serine. And this type of inhibition is also called as covalent inhibition, because it is forming a covalent bond with the oxygen of the serine residue. Whenever this is inhibited, the transpeptidase enzyme will loses its actual function. If it loses its actual function, then there is no there is no cross linking of what we say peptidoglycan, leading to the cell inhibition of the cell wall synthesis, which ultimately leads to what? Cell lysis. So, the structural feature is important. And another feature, if you see the carboxylic acid which is present in penicillins, it is also forming a ionic interaction with the amino group of the lysine residue present in the transpeptidase, and that is why it is also important. It is also making some hydrophobic interactions, the methyl groups, and like this different components of this molecule are quite essential for the activity. And coming to the detailed SAR of penicillin, and as I told, the beta lactam ring, it is crucial for the activity, as well as the thiazolidine ring. I told that beta lactam is highly strained ring. The thiazolidine ring will further increases the strain of the beta lactam ring. As it is further increasing the strain, it is anchoring or potentiating the breakage and inhibition of the transpeptidase enzyme. That is why it is acting as a structural support. And I told previously that there is a side chain R which will influence the stability, acid stability, as well as the spectrum of the activity. And already initially penicillin G and penicillin V were developed, but they does not have the satisfactory properties. The problem with the earlier versions of the penicillins is they have no acid stability, because if you want to treat infections, you will give penicillins in the form of a tablet. But whenever you give some penicillins in the form of a tablet, the environment here in the gastrointestinal tract, particularly in the gastric region, is acidic. The acidic medium will degrade the penicillin molecules. It is degrading means there is no action, the beta lactam ring is degraded. So, one of the important reason for modifying penicillins is we need to increase the acid stability of the penicillins, so that they can become orally active. You cannot inject penicillins continuously for treatment of some type of infections, right. That is why definitely it is mandatory, or it should be a basic consideration in developing any type of drug, that it should be orally active, so that there is a lot of convenience for the patient rather than that of the injection. And not only that, the other problem is, as the penicillins have been identified long back, there has been continuous usage of these penicillins. Because of the continuous usage of the penicillins, the problem here is the bacteria is surviving through resistance. We are unable to kill the bacteria because it is releasing an enzyme known as beta lactamase. The beta lactamase enzyme that is released will also degrade the penicillins, and if the penicillin is degraded already, it cannot interact with the transpeptidase enzyme, so that we cannot treat the infections. That is another big problem or the challenge. Not only this, nowadays the most important problem is the drug resistance, both in the treatment of cancer as well as the microbial infections. And the alarming thing is, we have been pushed into, because of irrational use of antibiotics, we have been pushed into a scenario known as post-antibiotic era. Previously, I told that before the discovery of most of the earlier versions of the antibiotics or the antibacterials, we were in the pre-antibiotic era, and still now we survived well, but because of what we say, this increase in the drug resistance by the bacterial species or different types of infectious agents, we are landing into a post-antibiotic era, which is a critical thing. That is why there is a greater scope for research in the area of drug resistance. This is also the case for the cancer treatment, right. And the other problem is, most of the penicillins, I told that the gram-positive bacteria are rich in peptidoglycan layer. As the beta-lactam antibiotics like penicillins inhibit the peptidoglycan layer, they are typically more active against gram-positive, and they have less activity against gram-negative bacteria. That means we need to improve the spectrum of the activity. Like this, in order to increase the spectrum of the activity, we need to modify the structure of the penicillins. So, there are three important things. One is